Hey everybody, it's Dr. Ryan from Infinite Wellness here in Glen Carbon. And one thing that we deal with a lot, again, is knees. We take care of a lot of people. We take care of a lot of people's knees, whether they're arthritic, whether they're just damaged from sport, etc. From ages, from little kids all the way up to 80-plus-year-old folks. So one big thing that we find is something called patellar tendonitis. And what patellar tendonitis is, actually, I'll look at this leg. I'm actually stretching this leg, believe it or not, as we're doing this, and it hurts because I'm pretty tight. And I'll explain this stretch. But patellar tendonitis many times it's all the times really, it's going to exist right here under that kneecap. Okay? So you have your kneecap, you have the point of the kneecap, and it's going to go down to that tibia. That's the bone down here in the lower leg. And if you have pain right here, if you have pain in that area, that is a sign you have patellar tendonitis. Now it can get very severe. I had significant pain through high school and college. Played a lot of basketball and I never even thought to stretch my hip flexors and my quads. Okay, and so that's really one of the biggest things that you can do to help to prevent this and also to treat this, because prevention many times is the treatment. And so what you need to do if you're getting pain here, whether it's, I had it a lot with jumping, it hurt like heck to jump. And so if you have a lot of pain with jumping, especially right below the kneecap, stretch your hip flexors. So one of the stretches is this one right here. If you can come around to the side here. So this is actually called a couch stretch, okay? Couch stretch is, as you can see, imagine this be the couch, putting your foot on the couch, knee on the ground. I always like to have a cushion. I have bony knees. I want to make sure that my knees don't hurt even worse after doing this. But a couch stretch is very, very good to stretch out the hip flexor and the quad. I also tell my patients and many folks to take your hand and actually lock that hip out. That will actually lock this region out, and this is going to help to isolate that hip flexor even more. Because if we can loosen this, if you can imagine a rubber band all the way from here down to below that kneecap, we loosen that up, then you're going to get that patellar tendon to loosen up, and that inflammation is going to decrease. And that's what we're looking for. Again, many times it's an easy fix if we just take time to think about what's going on, and also too to just do our self-care and not have to worry about coming in, getting injections, doing all this stuff, spending all this money. So again, I'm Dr. Ryan from Infinite Wellness. I hope this helps for those of you out there that may be dealing with this. Stretch those hip flexors and quads. It'll make a huge difference on how those knees feel, heal, and operate. So God bless.